At latest count, people were waiting in Texas jails an average 233 days for a maximum security state hospital bed to have their competency restored. By law, they must receive that critical mental health treatment before they can stand trial and actively participate in the court process. But 233 days is a dramatic drop from the record just a few years ago when people waited a record average 827 days. The number of people on that list has dropped too, from more than 2,500 a few years ago to fewer than 1,800 today. In that time, we've continued asking the Texas Health and Human Services Commission, what about the people waiting so long they die before getting help? The agency wasn't tracking that statistic then, and it isn't now. But lawmakers last legislative session directed the state auditor to take a one-time look at that number, among others. And the pieced together snapshot showed at least 54 people have died on the wait list since 2018, most of those in jail, something their loved ones say should never have happened. What do you think when you hear that number?
Well, I mean, I think of my brother. For first thing I do is I think about my brother. He's one of those statistics.
Walter Macias doesn't like to recount what his family faced in 2018, but he continues telling the story, hoping leaders will act after hearing about his brother, Fernando.
He was very intelligent. He did very well in school. He was, always studious, and just almost like one day when he was like 21 years old, I just got word that he had a mental breakdown. I didn't know that it was that severe, but ever since that time, he was pretty much a different person. It wasn't the same brother that I knew.
Fernando was diagnosed with manic depression, schizophrenia, and bipolar disorder. Eventually, he was living with their elderly mother, who had helped care for him as his health failed.
So all those years of medication took a toll on his body, and some of his kidneys were the thing that, in the end, that started. He started deteriorating the most from his kidneys, and he was having to go on dialysis.
Walter says at age 61, his brother had stopped taking his medication and began to lose his sense of reality. It led to a welfare check and police surrounding his Bexar County home.
My mother was in the house, and that she was in a wheelchair, 84 years old, in a wheelchair.
Their mother was killed in the shootout. Fernando faced 3 counts of attempted capital murder of a police officer.
He went into the county jail, and they deemed him to be mentally incompetent to stand trial.
A state jail standards report detailed his repeated refusal of medical services, food, and dialysis, and his declining health related to kidney disease and diabetes.
He wound up dying at the county jail because he could not get the kind of help he needed to get him stable.
It's really tragic. The people are dying while waiting for care. We don't know the causal relationship between their death and their psychiatric circumstances because we're not studying it.
State Senator Sarah Eckhart filed a bill last legislative session to study the availability of state hospital beds and their projected need, an effort to gather data to better implement solutions, including the prevention of deaths on the wait list. It passed the Senate, but not the House.
We are relying on a patchwork of data, and therefore we are left blind as to what we're facing.
This session, she refiled the bill. Why do you think that the state still doesn't track deaths?
I think the state isn't tracking it because they're afraid to know. They're afraid to know.
So the study you're proposing maybe could be a good first step toward regular tracking.
I think regular tracking is absolutely essential, and if we want to wrap our arms around the escalating costs at the local level, if we're going to blame the locals for coming up with solutions that cost property tax dollars, maybe we should take a look at ourselves first to see what kind of investments we're making at the state level.
Since the beginning of last session, the number of usable state hospital beds has risen substantially, from around 1,500 to 2,000 total available today. That includes an increase from fewer than 200 to nearly 350 available maximum security beds today. The type Fernando was awaiting, just like hundreds of other people now, even with these improvements.
I think the state's going to have to step up and build more facilities and understand that the situation, I mean, it's a public safety issue. It's an issue that can happen to any family. We had a good, loving family, and this changed everything.
Health and Human Services says adding beds has definitely helped the wait list, crediting state leaders for investing in expanding, renovating, and building new hospital facilities across Texas in recent years. The state has also purchased private beds in the community to free up space at state hospitals for competency restoration cases. It's also created 15 outpatient restoration programs and contracted with 18 jail-based programs across Texas since last session, and added more than 1,600 staff positions to state hospitals since then. Still, as of last month's HHSC committee meeting monitoring the wait list, deaths were not part of its regular tracking and did not come up in the discussion, despite our repeated questions. We'll keep you updated on any moves that might change that in the future. Catch up on our complete coverage on our website. Just click on this week's State of Texas story and scroll to the Mental Competency Consequences link. Texas could be on the path to invest in cryptocurrency. We look at what lawmakers are considering and why some people are raising concern.